I'm going to be talking about fragmented time and then as a general concept, and then apply it in a study that we did on the UK social care sector. What I mean by fragmented time is using strict work scheduling to focus paid work hours at times of high demand, and not rewarding or recognising work-related time between periods of high or direct customer demand. Now that's obviously very linked to what Guy was talking about this morning about a lot of work that goes on that's not necessarily rewarded, and also what is rewarded being shrunk and narrowed for various groups of workers. I would like to say that this partly builds on a paper I wrote, or Alex, the reason I was invited, a paper I was writing in 2005 in Time and Society, where I was actually contrasting two developments, one towards fragmented time for part-time workers and one towards results-based time for full-time workers, where actually people in regular, if you like, full-time jobs are increasingly working whatever hours are required, and the whole hours dimension of work has disappeared. But I just wanted to mention that because I'm actually going to be focusing only on the fragmented time, but it doesn't mean I think it's what's happening everywhere, but it's a good example of what's been happening in social care, and to understand that as a particular problem and phenomenon. The impact of fragmented time is to shift the risks of changing customer demand onto staff, and to increase work intensity for each paid working hour, and also to blur the boundaries between employee and self-employed status. All of those things we've already discussed this morning. Unlike the self-employed though, particularly in social care, people aren't finding their own clients. They have to be available, they're on-call workers for the employer, rather than those advertising independently looking for their own clients. And I could explain why I don't think that would work anyway in social care, or not for most of the social care that we organise. Now, fragmented time is a real challenge to the standard employment relationship. I was anticipating that Guy might still be here so that we would be having an argument about whether or not we had to abandon the standard employment relationship, which is his line of argument. And you might notice this morning he said we can't go back. Yet in many of the things he was asking for, we were going back for some dimensions, but for some reason he thinks we can't go back and actually require employers to retake responsibility for work. And I think that's a fundamental issue, because although you can do some things through social protection, actually the costs of doing it through social protection are very high for the state, and also everything done through the state leaves us vulnerable to what's been happening in the UK at least, and other countries since the crisis, whereby the state is very able to roll back social protection very quickly. So if we don't have employers providing support, then we're very vulnerable. I mean, I think it's, for me, it's always got to be a two-handed form of support. So I think the standard employment relationship has to be reformed, has to be rethought, but I think the standard employment relationship as a relationship that involves employers in part of the decommodification of labour, of not treating labour simply as a commodity, is a fundamental issue, and that we need still to think about how we can reclaim those rights through decommodification employment, and how we can organise to prevent this commodification of labour that's associated with the fragmentation of time. And I just put up Gerhard Bosch's paper, which is on why we need a new standard employment relationship, and I think it's very important that we see this as a very important part of civic society, and without it, it's very hard to think how we can have a progress in the future. So just to sort of clarify what I mean by fragmented time and the commodification, I've got here what I think the standard employment relationship provides and what fragmented time doesn't provide. Under the SER, we get guaranteed wage income, whereas under fragmented time, there's often no guaranteed hours or income, adequate pay for subsistence, and maintenance of real pay. Under fragmented time, it's often less than adult subsistence, and also may involve high costs, such as travelling into work to find you're only offered an hour or 2 hours, or even sent home straight away. Stability of employment, income during non-work periods, which is extremely important, the fact that you're not only paid when you're actually at high peak of activity, Division of work and non-work times. We've talked a bit already about this blurring of the divide between these two. And certainly under social care, we've moved to a situation of treating 24/7 as the same time with or almost no requirement for any compensation for working across the whole of the week. I would like to remind people, as a mother of a junior doctor, that they're on strike again today around these issues. The retail workers won yesterday, but apparently doctors have to still sacrifice their weekends for the greater good. We're still... Anyway, there's also the issue about upgrading skills, maintaining employability. Why would employers invest in people on fragmented time contracts? Adjusting to the needs of the individual is obviously one part that you might expect under a standard employment contract. If you're sick, or a family member is sick, or you have might expect your employer to adjust. Under fragmented time, you may be able to get adjustment, but it's certain that you'd pay the cost, in the sense you wouldn't be paid if you were taking time out for those reasons. And you might also lose your job. So you've got a double potential whammy there if you're in fragmented time. There's limited opportunities for voice if you're dependent on goodwill from the employer to get your next hour of work. And often you're unable to access employment protection and social security because they're not reaching earnings thresholds and continuity thresholds. And there are many stories for 0 hours contract workers of their hours being reduced in the run-up to being made redundant, so the redundancy payments aren't payable. Maternity leave too. You're entitled to maternity leave when you tell your employer. You're not by the time you're actually taking maternity leave, because the hours can be reduced. So this is the context of which and this is why I think it's so important to put these developments in. It doesn't mean that I'm sort of saying everybody's on 0 hours contracts, but I think we heard today in the paper the estimates have gone up yet again to 800,000 workers. But what I'm particularly concerned about is its role in social care, which I think is a bit different from other areas. I think 0 hours contracts are a necessary condition for full fragmented time, but some users of 0 hours contracts use it for different reasons. And I think lumping them together might actually distract attention from this issue of fragmented time. Because you might be using a 0 hours contract for seasonal work, and most of the time people are doing this seasonal work on continuous shifts, and the role of the 0 hours contract is just, say the weather breaks at the end of a summer season, the employer just wants to terminate the contract 2 weeks early. But up until that point, you're working continuous shifts, you know when you're working. It's not necessarily that 0 hoursy, if you like. If you run events like weddings or concerts, you often have people on 0 hours contracts. But when you bring them in for a continuous shift. There's nothing. Even when you're in a retail or hospitality, varying working patterns over the day or the week, you may still involve continuous shifts of varying lengths. So that's not necessarily the full fragmented time. And I've got these diagrams that I can see. This is the sort of lumpy demand where you might use 0 hours. This is a seasonal demand. And this is variations in weekly demand. But the thing about social care is you need care every day. It's not very seasonal. It's fairly even over 7 days. You can't suddenly look after yourself on a Sunday. Most care staff are also working more than 20 hours. They're not working short hours. Sometimes they work very long hours, but still almost all are on 0 hours. And I think the reasons are as follows. Care is time and location specific. I'm talking here about domiciliary care, by the way. You don't find 0 hours contracts as much in residential care, so it's a different kind of labour process. There are peaks and troughs over the day, and there are constantly changing composition of clients, which leads to changing volumes of locations and schedules. And as we will be seeing, one of the reasons for 0 hours contracts is to get the workforce to agree to that changing composition without any argument, because they've got no right to any other work. And care is commissioned and paid for face-to-face care time only, and that's largely due to the fact that that's how local authorities pay the agencies. So it's nothing to do with digitalisation, it's to do with a social decision that this is the way we'll pay the care. And I think this is taken from the web. It's a software program that they sell to domestic care, domiciliary care agencies. And you can see how they want to schedule work for these different people. What's interesting is around this software, there's some discussion telling people not to have too long a breaks, because then you'll have conflict between, with the workforce. So you sort of have these ones where there's a bit of time between each visit that's not paid, but it's not long enough to create a sort of major problem. Or you can see for each, across the whole working day, there are quite major breaks. Sometimes it's all concentrated at one end. This person is doing mornings, lunchtimes, and evenings. So very extensive working days, but only some bits of it paid for. So I think the benefits for 0 hours contracts for employers in social care is that they can pay, there is no minimum work periods in the UK employment rights system. They can therefore provide unpaid work breaks between calls. The only time when you're an on-call worker, when you don't have to, where you have to be paid, is if you're on call at the place of work. So if you're in Burger King and they send you to the back room to wait till somebody comes in to order another burger, you ought to be paid. But social care is ambiguous, because are you at the place of work when you're hanging around in a cafe several miles from the headquarters waiting for the next visit? Sitting in your car, are you in your place of work? You haven't got time to go home. If you had time to go home, you unambiguously wouldn't be entitled to pay, which is obviously a problem. There's also, and this has been an ongoing issue, about non-payment of travel time. The local authorities do not pay for the time taken to get moved between these different clients. That's not included in their way in which they pay the agencies. They pay very low hourly fees, often several pounds below the minimum that the UK Home Care Association has calculated is necessary to pay the minimum wage for travel time. Yet the Low Pay Commission has clearly stated that this is work time and should be paid for. So I think the 0 hours contract is in a way establishing a situation where people do not expect to have continuous shifts. They've got no guarantees of work, therefore each piece of work is a bit like those platforms we've been talking about, a task. And after the task, it's unpaid until you get your next task. And it's compliance with these constant changes to schedules and by time and place that is the main reason behind 0 hours contracts. What I think is interesting, although 29% of the people, of the agencies in our study here were using electronic monitoring, 71% were not. So it's not a function of electronic monitoring. Electronic monitoring makes it worse. You may have to log in and log out when you go on calls, but you're not being paid anyway, even if you're on a system that doesn't have that. So in contrast to everybody else today, what I'm saying is these are social organisation, it's not technology, although technology can make things worse. So very quickly, now I'm going on to my research. I've got quite a lot of slides. I'll probably skip over some of them. It has been published in Human Resource Management, the American Journal, just this year, and a special issue on care. So you can find it there. So apologies if I skip over, but just to give you a flavour of what we're finding. It's a study we did for the Department of Health. It was a very large-scale study with quite a lot of local authorities, quite a lot of agencies. I'm going to be mainly focusing on the 52 independent sector domiciliary care providers that we looked at. We also did 10 in-detail case studies with looking at employees, and I'll be drawing on those as well. So it's mainly the 52 private sector providers and the employees of, well, actually it's 8 of them that we'll be looking at. And the objective was to explore why there was a problem of recruiting and retaining a care workforce for older adults. In a word, low pay, but never mind. That's I felt like offering them, well, you don't really need to pay me this amount of money to go and research it, because I know what the answer is, but we also found some support that was the case. 89% of hours in domiciliary care at that point were undertaken by private or voluntary sector providers, and most paid for and commissioned by public funds. So our underlying hypothesis was that employment conditions were influenced both by care commissioning and by employer HR policies. In practice, the employer HR policies are more similar than we expected. We thought that we might be able to find, good enlightened employer HR policies and bad employer HR policy. In fact, we found much of a muchness, because in fact the care commissioning policies are grinding everybody down so much that there's not much scope for the employers to do things. So we found a high degree of similarity in commissioning strategies and in employer HR practices, all towards fragmented time arrangements and low pay, and some tendency for better commissioning to improve HR, but within a very narrow range. And so actually, individual local authorities deciding to improve things wouldn't necessarily help that much, because some, particularly under the chains, would take that more as an opportunity to offset the fact they've been ground down in some local authorities and not in others, and they just mainly take it in terms of profits. So I think we need a more national strategy than that. Just to give you some idea, this doesn't cover everything. We've got about 21 issues in our fragmented time index, which I'll show you in a minute. But just to see the extent, we've got 69% of our providers had everybody on 0 hours contracts. Most of those that didn't had a mix were people who were providers who'd taken 2P transferred staff from the public sector. Only 1 or 2 actually didn't provided non-0 hours contracts of their own volition. 88% didn't pay breaks between clients. 27.5% had a maximum working week of 7 days, even though that's not really legal. 49% 6 days. 60% of the providers had all staff working weekends, and around 3/4 had 3/4 or more of staff working weekends. Quite a lot of working longer than scheduled. This is indicated by the fact it was mainly the existing staff on the 0 hours contract who were used for any additional cover. So people were constantly, given there were new clients coming in, people being off sick, and not being able to make the new arrangements. Obviously, everybody was sort of fairly open to calls to be brought in at short notice. No minimum length of visit less than 30 minutes in 65% of cases. 52% having no minimum work period, and an additional 19% having one of less than 2 hours. Some having people working alone at night. Interestingly, the only positive story here is that the providers say that 73% allowed staff to have hours to match their preferences most of the time, and 2% some of the time. This story, and it will be, I don't know how much time I'm going to, you need to tell me when I've got 5 minutes or something. Yeah, just 5 minutes, okay, right. The point is that our story is that this notion that we're adjusting to preferences is within the context in which everybody was being hired under the explicit thing that they had to work 0 hours, 24/7, whenever they wanted. So any adjustment was seen as a sort of positive, often by the employees and by the employers. But it's not within the realms of what we would call a standard or family-friendly working time. So this story that everyone gets most of the what their preferences are within the constraints under which they were operating, rather than what most people would understand as, if you like, family-friendly working time arrangements. What you can see from our index in short, if you scored 1, you would mean on all the elements you were actually providing non-fragmented time arrangements. You can see that here's the 5, most of ours scored under 50%. So there's a huge gap between what they were doing and what you could say was a standard employment relationship, a sort of normal employment relationship. And you can see also from the pay data there that it's not related actually to whether they were good payers or high payers. This sort of poor working time arrangements were common independently of that. And there are various quotes where it tells you about how people were out and started at 8, 6 hours, only getting paid for 3 hours of work, etc., etc. But also people not making the clients flustered and actually taking the time if necessary, even though it rolled into their own time. So a lot of extra work going on. These will say something about their working schedules. Sometimes they're very complicated. Monday, Tuesday, and Wednesday I work half a day, then Friday and Saturday I work half a day on Sunday. But but also between breaks, because I don't drive, most of the time is spent in the buses. So this is the period when they're not working. Somebody here has been 12 days on and 2 days off. I do 8 till 2 and then 4 till 10. That's the kind of working schedules we're talking about. And this is an example where the council had not provided adequate fees for this particular client, and then the company said, and the people were actually working sort of like twice as long as they were supposed to, or well, it's an hour and a quarter, and then said, we as a company, as a business, cannot pay them for that time, but the council can't agree it, and we can't leave someone without care. I think that's one of the most telling quotes in our study, that the only people who therefore had to bear the burden were the care workers, because the company wasn't going to accept it and the council wasn't going to accept it. But they couldn't leave somebody without care, but they weren't going to pay for it. The outcome, I'll run through the story, is just major shortage of labour, and there was no major initiative to change the HR policy to reduce shortages, unlike you might be taught in business schools about how you would use a high-performance management system to overcome these problems. There was no scope to do so, and so we used a framework saying this is a partial route to failure. Everything they did was not really addressing the fundamental issues, and running forward, because I'm short of time, they tolerated, 69% had labour shortages for weekend and unsocial hours, 37% for night work, hiring people without desirable attributes, never rejecting a suitable applicant. That shows you how difficult it was to recruit people. If they could see somebody who would work, they would take them on. And of course, with 0 hours, they could just give them a few hours, take them off somebody else, but just so they didn't lose them. And high rates of turnover. But they didn't do much. They all paid near the minimum wage. They might pay 25 pence extra for getting a qualification, up to £1 an hour for being a senior care worker or a supervisor. Nothing very much. But they all had lots of appraisal and staff attitude surveys, because guess what? They were in the council tenders to show good HR practices. A lot of informal recruitment going on. Emphasis on, necessary positive attitude, working weekends, working earlies and lates, living locally, and care skills. Those were all the most important things that would make them available 24/7, although working time was the most common reason for quits. Some care managers already said, recognise that that's within the constraints of when they say they help people out and allow them to work when they wanted to, that's within that kind of constraint that you have to accept you're working these sort of very diverse hours. But some managers will say, oh, we're very helpful, people join because we're flexible and we can work around family responsibilities. But actually what's really going on is this last quote, where the coordinators in the office often had to go out to fill in gaps. The new recruits had to do all the bum jobs because they knew their senior staff their experienced staff would reject them. But then, of course, the new recruits then left. And where we do find adjustments, they were often initiated by the workers themselves, sort of establishing their own set of clients, making certain they hang on to them. This one decided to stop doing the tea time run and started at 6 o'clock in the morning instead. So they made their own arrangements, but the managers often took responsibility for that and said, oh, we're very flexible and we adjust to people's preferences. So I think I've got to conclusions. So we do see mutual adjustment taking place, but within this fragmented time context. And it's very difficult. The existing staff who we could interview were very committed to the job and had high job satisfaction. The real problem is you can't expand the pool because you need everybody who's local. Once you've got all the people recruited who's local, what are you going to offer next? You can't offer higher pay, you can't offer continuous shifts. Why would people commute from one area to another for this kind of work? So there are some people who get a lot of satisfaction from it and will be various reasons put up with it, but what the real point is it's a shortage of available people. And the current arrangements are nevertheless still parasitic on the labour time and goodwill of care staff, due primarily to commissioning practices, but there's no guarantee that any localised improvement in commissioning would transform that system. So just to recommend, we enforce the minimum wage for all work, we change commissioning practices, I think this is perhaps even more important, that we bring in minimum work periods and maximum unpaid break times during a working day. We make it absolutely essential that reimbursement of travel costs for short hours and short notice work. And I would favour some kind of guaranteed hours based on some kind of past work history, so that you can't have rapid reductions in your hours. You may, if you've worked on average so many hours for so many months, then the next period you should at least have, I've suggested here, 75% of that as a minimum, so that you build up credits and maybe they get run down if the company's having problems, but you don't go through this complete volatility that is potential. Okay, sorry.